Health insurance provider Managed Health Services is investing $1.2 million in 18 organizations across 28 Indiana counties, targeting youth mental health services. The funding comes from MHS Serves, a multi-million-dollar initiative focused on reducing health disparities. And with more on this is Wish TV contributor Emil Ekiyor. Thank you for joining us. So at its core, MHS Serves aims to help historically underserved populations access mental health. Why is this important?
I mean, this is so important. For years, we've seen this happen where while you're in high school in K-12, you have support if you're diagnosed with mental health issues, or maybe you have some kind of IEP, as they call it in high school, right? And you need support in high school. So the high school receives support to support you. The issue is once you walk out of the high school doors and you graduate from high school, in a lot of cases, a lot of young people don't have that support system around them to continue receiving the services they need. So this funding will help so many people, and it will help kind of create some kind of progression in this. So when you leave high school, if you don't have health insurance and you need assistance, you need help with mental health services, now you have an organization in your community and neighborhood that you could walk into, and that support can continue as you go forward.
Really building boots on the ground. And Indiana Minority Health Coalition and Black Onyx Management will be co-collaborators in this. I know you talk a lot about collaboration in all facets of our community. How is this a good example?
So this is really a perfect example of those kind of collaborations. Black Onyx is entrenched in the community. They have a lot of trust built in the community. So by partnering with them, you already have an organization that has name recognition, that has trust. So now when they walk into a room with a family or a young person that needs services, that person knows Black Onyx, knows the CEO of Black Onyx, knows the staff members, and they know that Black Onyx has their best interests at heart. So that opens doors. It allows you to be vulnerable in the space. It allows you to come to them and seek services and not necessarily wait for them to come to you. So those kind of collaborations with community organizations or businesses that are entrenched in the community allows things like this to penetrate. Too many times we've seen these great ideas, great programs, but they never reach the people they were designed to reach. In this case, I am so confident that the Minority Health Coalition, partnership with Black Onyx, the services and resources will get down to the people that were intended to receive it.
And quickly as well.
Exactly.
Untreated mental health illness is a personal issue, but left untreated can also create real economic burdens in communities. Should state level investments be focused on this?
Definitely. So the state is already investing, and the federal government is investing. Like I said, young people are diagnosed with mental health in high school. The high school receives additional resources to support that young person. Counselors, they get put on a plan, right? In a lot of cases, what we've seen is, in that time period, that young person sometimes doesn't learn the coping skills they need to deal with what they're dealing with, all right? I feel this way, I just don't know why I feel this way. How do I cope? How do I continue to live a productive life and understand what I'm dealing with? Well, if you never get the coping skills you need in high school, and now you graduate into the world, and you still don't understand how to deal with that, so you need additional services, you need additional support. If that support isn't there anymore, so you've graduated, you have no support, you still don't understand how to deal with what you're dealing with, and we see that so much with young people. So it's like being blind and no one has ever taught you how to use a Braille. It's so hard to survive, and we see so many young people struggling, but there's no help for them, there's no support for them. So today with this, we just hope that, just like we're doing, we're educating the community about this resource that's available. We need more people to do that. We need more young people to take advantage of this. And then we need to find a way to measure, how is this working? How do we know, what are the wins? What are we measuring for success to understand, is this working? And then if it's not working in the short term, how do we pivot and fix it? So we don't wait years down the road to find out it didn't work. So those are the kind of things that we need to learn more about, the resources that are being provided. And then let's come back a year from now to say, here's what has happened, here are the wins, here are the things that need to be changed. So that way we keep progressing.
All right, so if you hear about these services, you think you need them, go ahead, take advantage. Wish TV contributor Emil Ekiyor, thank you for joining us today.
Thank you for having me.